If you've been doing Kegel exercises hoping to improve your performance and stamina, but you're seeing zero results or even making things worse, you're not alone. 90% of men perform Kegels incorrectly. And that mistake isn't just wasting your time, it's actually weakening the very muscles you're trying to strengthen. I'm Dr. Linda Parker, wellness and longevity advocate, and today I'm going to show you the exact 2-minute technique that fixes the most common Kegel mistakes and delivers the stronger, more reliable function you've been working toward. Let me be completely honest with you. The standard Kegel advice you find online is dangerously incomplete. You're told to squeeze and hold, to do hundreds of repetitions, to practice while urinating. But nobody explains the critical details that make the difference between wasted effort and dramatic results. And worse, nobody warns you about the devastating mistake that most men make, the one that creates chronic tension, premature exhaustion, and the exact opposite of what you want. Here's what's really happening when you do Kegels wrong. Your pelvic floor isn't just one muscle. It's a complex network of muscles that need to work in perfect coordination. When you squeeze too hard, hold too long, or forget the relaxation phase, you create imbalanced tension. Some muscles become overactive and tight, while others remain weak and unresponsive. This imbalance leads to exactly what you're trying to avoid: unreliable function, reduced stamina, and frustration. The truth is, stronger masculine function isn't about how hard you can squeeze your pelvic floor. It's about control, coordination, and the ability to engage and release these muscles with precision. A tense, chronically contracted pelvic floor is just as problematic as a weak one. In fact, many men who complain about poor performance actually have overly tight pelvic floors from years of doing Kegels wrong. So let's fix this right now. The correct technique has 4 essential components that transform a useless squeeze into a powerful therapeutic exercise. Miss even one of these components and your results will be minimal at best. First, you need to locate the correct muscles, and this is where most men go wrong immediately. The pelvic floor muscles you want to target are the ones you use to stop urination midstream or to prevent passing gas. But here's the critical detail. You should feel the contraction deep inside your pelvis, between your pubic bone and tailbone, not in your buttocks, not in your inner thighs, and definitely not in your abdomen. When you squeeze, your glutes should stay completely relaxed. Your thighs should remain soft. Your belly should not tighten. If any of these areas activate, you're recruiting the wrong muscles and wasting energy that should go to your pelvic floor. This is the single biggest mistake men make. They turn a pelvic floor exercise into a full-body clench that accomplishes nothing. Here's how to find the right muscles with absolute certainty. Sit comfortably in a chair with your feet flat on the ground. Place one hand on your lower belly and one hand under your tailbone near your anus. Now imagine you're trying to stop urinating and prevent gas simultaneously. You should feel a gentle lift and squeeze deep inside your pelvis, but your hands should detect zero movement in your belly or buttocks. If your hands feel tension or movement, you're doing it wrong. Reset and try again with less effort, focusing only on that deep internal lift. The second component is the contraction itself, and this is where the 2-minute protocol becomes crucial. Traditional Kegel advice tells you to hold for 10 seconds and repeat dozens of times. That's completely backwards. Your pelvic floor has 2 types of muscle fibers: slow twitch fibers for endurance and fast twitch fibers for power and immediate response. You need to train both, but in very different ways. For the first minute, you're training the fast twitch fibers that give you control and immediate strength. Perform quick, sharp contractions 1 per second. Squeeze firmly, but not maximally. Hold for just 1 second, then release completely. The release is just as important as the squeeze. Let the muscles go fully soft before the next contraction. This quick pulse pattern squeeze, release, trains your pelvic floor to respond instantly when you need it, giving you better control and responsiveness. Count out loud as you do these: 1 squeeze release, 2 squeeze release, 3 squeeze release, all the way to 60. This first minute builds the reactive strength and neural control that translates directly to improved performance and confidence. For the second minute, you switch to slow twitch endurance training. Now you perform slow, sustained contractions. Squeeze to about 70% of your maximum effort, not a death grip, just firm and controlled. Hold this contraction for 5 full seconds while continuing to breathe normally. This is critical. Do not hold your breath. Holding your breath creates internal pressure that works against your pelvic floor and can raise your blood pressure dangerously. After 5 seconds, release completely and rest for 5 seconds. During this rest, consciously relax your pelvic floor. Let it go completely soft and heavy. Then repeat. You'll complete 6 of these slow contractions in the second minute. This trains the endurance capacity of your pelvic floor, the ability to maintain strength and control over extended periods. The third component, and this is the one that separates mediocre results from extraordinary ones, is the relaxation phase. Most men completely ignore this. They go from one contraction to the next without truly releasing the tension. Over time, this creates a chronically tight pelvic floor that never fully relaxes, leading to discomfort, tension, and ironically, worse function. After your 2-minute protocol, spend at least 30 seconds in complete pelvic relaxation. Sit or lie comfortably, close your eyes, and bring your awareness to your pelvic floor. With each exhale, imagine your pelvic floor muscles melting, softening, releasing downward. Visualize them as a hammock that's gently lowering, completely letting go of any residual tension. This relaxation phase teaches your nervous system that your pelvic floor can fully release, which is essential for healthy function. Muscles that can't relax properly can't contract powerfully either. They remain in a semi-contracted state that limits their range and effectiveness. By training relaxation as deliberately as you train contraction, you develop true pelvic floor control. The fourth component is consistency and progression. 2 minutes daily, every single day, is infinitely better than 20 minutes 3 times a week. Your pelvic floor responds to frequent, regular stimulation. It's like learning a language. Daily practice for short periods is more effective than occasional marathon sessions. For the first 2 weeks, stick to exactly this protocol. 1 minute of quick pulses, 1 minute of slow holds, 30 seconds of deep relaxation. Do this once daily, preferably at the same time each day to build the habit. Morning is ideal because your muscles are rested and responsive, but any consistent time works. After 2 weeks, if you're performing the technique correctly and you feel comfortable, you can add a second session later in the day. But never exceed 2 sessions daily. More is not better with pelvic floor training. Overtraining creates fatigue and tension, exactly what you're trying to avoid. Now let me share what happens inside your body when you do this correctly. Your pelvic floor muscles support the structures involved in masculine function and control the blood flow mechanisms that create and maintain firmness. When these muscles are strong and coordinated, they compress the veins that drain blood away, allowing engorgement to build and sustain. When they're weak or uncoordinated, blood drains prematurely, leading to inconsistent or unreliable function. The quick pulse training improves the neural pathways between your brain and these muscles. It's like upgrading the wiring so signals travel faster and more accurately. This translates to better voluntary control, the ability to engage these muscles precisely when you want, how you want. The slow hold training builds the actual strength and endurance of the muscle fibers, giving them the capacity to sustain effort without fatiguing. Within 2 weeks of correct training, most men notice improved morning vitality, a sign that the neuromuscular system is responding. By 4 weeks, control and reliability during intimate moments typically improve noticeably. By 8 weeks, many men report function they haven't experienced in years, all from 2 minutes of correctly performed exercise daily. Let me tell you about Michael, a 58-year-old who came to me frustrated and embarrassed. He'd been doing Kegels for 6 months after reading they would help his declining performance, but he saw zero improvement. When I watched him demonstrate his technique, I immediately saw the problem. He was clenching his entire lower body, holding his breath, and never fully releasing between contractions. He was basically doing 2 minutes of full-body tension that accomplished nothing. I taught him the correct protocol: isolated pelvic floor engagement, quick pulses for 1 minute, slow holds for 1 minute, complete relaxation for 30 seconds. Within 3 weeks, Michael reported morning improvements he hadn't seen in over a year. By 6 weeks, his confidence in intimate situations had returned completely. He said it felt like his body remembered how to work properly, and in a way, that's exactly what happened. We retrained his neuromuscular system to function correctly. Here's another critical point that most advice completely misses. Your pelvic floor doesn't work in isolation. Its function is intimately connected to your breathing, your core stability, and your overall body tension. When you hold your breath during Kegels, you create downward pressure on your pelvic floor that fights against the upward contraction you're trying to create. It's like trying to lift a weight while someone pushes down on it, exhausting and ineffective. The solution is coordinated breathing. During the quick pulses, breathe naturally and rhythmically, 1 breath every few contractions. During the slow holds, inhale before you squeeze, then exhale slowly during the 5-second hold. This breathing pattern supports your pelvic floor rather than fighting it, and it keeps your blood pressure stable. Also important is your posture during the exercise. Sitting upright in a chair with your spine neutral and your feet flat gives your pelvic floor the optimal position for both contraction and relaxation. Slouching compresses your pelvic region and makes proper engagement nearly impossible. Standing works too, but sitting is ideal for learning the technique correctly. Now let's address a major concern many men have. What if you can't feel your pelvic floor muscles at all, or what if the contractions feel incredibly weak? This is more common than you think, especially if you've never trained these muscles, or if you've had pelvic surgery, prostate issues, or nerve damage from diabetes. If you struggle to feel any contraction initially, try this modified approach. Lie on your back with your knees bent and feet flat. This position reduces the work your pelvic floor has to do against gravity, making it easier to sense the muscles. Place your fingertips on your perineum, the area between your scrotum and anus. When you perform a Kegel, you should feel a slight lift or tightening under your fingers. This tactile feedback helps your brain connect with these muscles. Practice in this position for several days until you can reliably feel the contraction. Then gradually transition to sitting, and eventually you can do the exercises anywhere, anytime, without anyone knowing. But master the basics first in the easiest position. Let's also talk about what not to do, because avoiding these mistakes is just as important as doing the technique correctly. Never practice Kegels while urinating, except once initially to identify the muscles. Repeatedly stopping urine flow can confuse your bladder's normal signaling and potentially lead to incomplete emptying or urinary issues. Never squeeze with maximum force. Your goal is controlled, sustainable contraction at about 70 to 80% of maximum. Maximum squeezing creates excessive tension and fatigue without additional benefit. It's like trying to build strength by only lifting the heaviest weight you can possibly move once, instead of using moderate weight with proper form repeatedly. Never skip the relaxation phase. I cannot emphasize this enough. Chronic pelvic tension from over-exercising without relaxation is a real problem that can cause pain, discomfort, and worsening function. Always end with intentional relaxation, and never expect overnight miracles. Pelvic floor strengthening takes time because you're literally building muscle tissue and retraining neural pathways. Realistic improvement typically appears between 2 and 4 weeks, with continued gains over 2 to 3 months. Trust the process and stay consistent. Here's a simple way to track your progress without obsessing. Each week, rate your morning vitality on a scale of 1 to 10, with 10 being optimal. Also, rate your confidence and control in intimate situations. Write these numbers down. Over weeks, you'll see objective improvement that motivates continued practice. And unlike subjective feelings that can vary day to day, this tracking gives you concrete evidence of progress. Another aspect rarely discussed is the connection between pelvic floor health and overall vitality. Strong, coordinated pelvic floor muscles improve circulation throughout your pelvic region. Better circulation means better nutrient delivery, better waste removal, and better hormonal signaling. Many men notice improvements not just in function, but in sensation, satisfaction, and overall pelvic comfort. Additionally, pelvic floor strength supports prostate health, bladder control, and even lower back stability. The benefits extend far beyond intimate performance. You're investing 2 minutes daily in comprehensive pelvic wellness that pays dividends across multiple aspects of your health. Let me address one more common mistake: trying to incorporate Kegels into other activities. Some advice suggests doing Kegels while driving, watching TV, or sitting at your desk. While this sounds efficient, it often leads to poor form and minimal results. These muscles deserve your full attention, at least while you're learning and perfecting the technique. Once you've mastered the proper form and the exercises feel completely natural, then you can incorporate them into your daily routine more seamlessly. But for the first month minimum, treat your 2-minute protocol as dedicated practice time. Find a quiet moment, focus completely, and do it right. The beauty of this 2-minute protocol is its simplicity and effectiveness. You don't need equipment, supplements, or complicated routines. You just need 2 minutes of focused, correctly performed exercise and the discipline to do it daily. That's a remarkably small investment for the returns it provides. Improved function, enhanced confidence, better control, and the peace of mind that comes from knowing your body works reliably. I also want to address the emotional component, because this isn't just physical. When masculine function declines, it affects confidence, relationships, and overall quality of life. Many men feel embarrassed, frustrated, or hopeless. They try various solutions, often expensive or with side effects, and feel increasingly discouraged when nothing works. This simple pelvic floor protocol gives you back control, literally and figuratively. You're actively doing something effective, something that works with your body's natural mechanisms. You're building strength and capacity that's genuinely yours, not dependent on pills or devices. That sense of empowerment and self-efficacy is incredibly valuable beyond the physical improvements. Many men also report that as their pelvic awareness and control improve, their overall body awareness increases. They notice tension patterns they'd ignored for years, they breathe more consciously, they move with better posture and alignment. The pelvic floor becomes a gateway to whole body wellness. Before we finish, let me give you the complete protocol one more time in simple, actionable steps. Find a quiet space where you can sit comfortably without interruption. Set a timer for 2 minutes. Spend the first minute doing quick pulse contractions. Squeeze firmly for 1 second. Release completely for 1 second. Repeat 60 times. Remember to keep your glutes, thighs, and abdomen relaxed, isolating only your pelvic floor. For the second minute, perform slow holds. Squeeze to 70% intensity, hold for 5 seconds while breathing normally, then release completely and rest for 5 seconds. Repeat 6 times. After your 2 minutes, spend 30 additional seconds in complete pelvic relaxation, consciously releasing all tension from the area. Do this once daily, every day, for at least 4 weeks before expecting significant results. Track your progress weekly with simple numerical ratings. And remember, correct form matters more than effort level. Less intensity with perfect form beats maximum effort with poor technique every single time. One final truth I want you to understand. Your body at any age has the capacity to improve, strengthen, and perform better than it does right now. Declining function isn't an inevitable consequence of aging that you must accept. It's often the result of weak, uncoordinated muscles that have never been properly trained. 2 minutes daily of correct pelvic floor training can reverse years of decline and restore function you thought was permanently lost. You deserve to feel confident, capable, and satisfied in every aspect of your life, including your intimate wellness. This 2-minute protocol gives you the tool to achieve exactly that. No more wasted effort on incorrect techniques, no more frustration from lack of results, just simple, effective exercise that delivers real, meaningful improvement. Starting today, you have everything you need: the knowledge of what was wrong, the understanding of what's right, and the exact protocol to follow. Now it's just about commitment and consistency. 2 minutes daily is all that stands between where you are now and where you want to be. Share this information with others who might be struggling silently, who've tried Kegels without success, who think nothing can help. This simple correction to a widely misunderstood exercise can change lives, restore confidence, and bring back vitality that seemed permanently gone. Your pelvic floor is waiting to respond, to strengthen, to function optimally. Give it the correct stimulus, the proper technique, and the consistent practice it needs. The results will speak for themselves in your morning vitality, your intimate confidence, and your overall sense of masculine wellness. Here's to doing it right and experiencing the transformation you deserve. See you in the next video.